We got a really special treat for you today. We got 4 brilliant CISOs. They're going to share their experiences with you, and they're all in healthcare. But same issues arise no matter what vertical or what organization you're working with as we're challenged. I'm Rich Greenberg, chair of the summit, former CISO for LA County Public Health. So I had a lot of years working with the system, with doctors, with red tape. And we have Todd Felker right here to my right. I know Todd for several years. He's a CISO with a demonstrated history of working in the hospital and healthcare industry. Next to him is Doug Murray, a recognized information security and technology executive with over 2 decades of information security and technical experience. Stan Banish is the CISO for the Children's Hospital of Orange County, and he had his own particular challenges, and they've all spoken with ISSA in the past, and they're all excellent. They were handpicked. And on the end is John Cronick, who I know for many years did some work for me and helped us out quite a bit in our risk management process. He's a leader in the field. He gave a talk, was yesterday, right, John? And was very well received. So we're going to get started. The way we will carry on is I'll ask some questions, as a good moderator is supposed to do. But we do encourage a little interaction. So if you guys hear someone say something that sparks an interest, or you disagree with, or you just need a little bit more explanation about, right, feel free, right? We love dialogue. We had a CISO forum here 2 days ago, and there was some fantastic back and forth with the audience. And it totally changed the direction of where we thought it would go, but it didn't matter. It was great, and everybody was happy. Okay, so please feel free to jump in. So I'm just going to kick things off with a question that probably lots of people are interested in hearing about, and that is, how do you get your arms around the HIPAA requirement for an annual risk assessment? Because I don't know how many of you do annual risk assessments, but if you're in a large company, it can be quite challenging. John, would you like to tell us how you think we should handle this?
Can you hear?
Yes.
Yep.
Right.
Okay. So I actually gave the talk yesterday on the risk annual risk assessment. But one of the things that you definitely need to read the reg as to what the requirement is. You can go to the HIPAA security tool to give you some guidance. The SRA tool is out there. But in reality, it comes down to 4 things. You have to identify all your assets and your data, right? So the key here, again, if you want to play to the regulators, is find out where all your EPHI data is. That's number 1, right? Without that, you can't do an effective risk assessment because it all centers around patient data. Certainly, all of your assets you need to inventory. So your infrastructure, networks, et cetera, you have to have that inventory. And you as security don't maintain that. You're going to go to your IT infrastructure folks, your network teams and everything. They should be maintaining that. They should have a list of all your hardware, software. You need to go to your application folks, get all the applications. Probably the smartest thing to do is look at find all your applications and find out which of those are processing PHI data, EPHI. And that helps you to streamline, that this is going to be the source of the data. Then you got to figure out everywhere in your organization that you have processed or stored or maintained, the PHI data. If you're putting it on copier machines, and printers, all the drums of those machines contain that data. You have to have some kind of a mechanism to wipe it out or protect it. So again, everywhere, if you have temporary storage, if it goes on a floppy drive, if it goes on a laptop, those are places where you have PHI data. You have to inventory that, and then you have to determine what kind of controls you have over that data and those mechanisms. Are you patching all your systems? Are you tightly controlling who has access from a user access control standpoint? You also have to do threat and vulnerability analysis of those two components. So first, where the data is, where it's stored, who has access to it, and then the medium or the mechanisms where that data is processed. So are you doing patch management? Are you taking care of end of life on equipment? Are you all your IoT devices have medical information on them? That has to be controlled. And I'll guarantee you don't have security on those devices. So you have to have some kind of compensating controls. All that has to be factored into your risk assessment, right? And when you do that, you've got to document it. All this is going to be looked at when the regulators come. They want to be able to see your logic on how you're doing that assessment. So if you inventory your assets, you determine who has access to that. You're doing the threat and vulnerability analysis of those things, and then the controls that you're using to offset that risk, right? Then what you do is you have what we call residual risk. These are things that you have to now take care of that you hadn't considered before. You might have gaps in that process. So when you're going through that HIPAA security requirement list, you're going to find out, oh, we don't do this, or we haven't updated our policies, because that's a big part of this, is that if you have policies, are they updated? Are people following them? Have you got security awareness training? And all those things that factor into this risk assessment. And once you've done that, you will have a residual risk, and that should be documented in a risk register. And that should be maintained, because that's your proof that you're doing all of this on an annual basis. And then what you'll do is you'll have to determine there's 4 ways to remediate or take care of that risk, right? So, and some of those things there is no solution, like the IoT devices. So what you're going to have to do is you're going to have to bring that to management and say, okay, here's our issue. Here's the risk. What are we going to do about this? We have to protect patient data. They're going to have to accept it or provide funding to remediate that. And that all factors into your annual risk assessment. Now, that annual risk assessment is also used for your evidence for meaningful use, right? So that every year, if your organization is getting funding for EHR system purchase and implementation, this meaningful use annual risk assessment is for Medicare and Medicaid proof that you're actually building in security into the EHR system. So all that has to be maintained, and then you provide that to the HHS or OIG or OCR when they come, or if they request it, which you have to provide every year. And the challenge is most organizations that I've encountered in the healthcare space have a very immature process for either risk management or for security in these areas that I just mentioned. So they don't do what I just said, and we find actually what you're seeing now is a lot more organizations are getting fined for failure to provide an annual risk analysis. And if you follow what I just said, you should have it covered. And it doesn't mean that you're addressing all the risks or that you've got a pristine environment. It just means you've gone through the logical process of doing a risk assessment. And I strongly suggest or encourage you that if you don't have that expertise in-house, that you do get an outside partner to come in and help you with that and set up at least the framework. And you definitely need to go to a risk framework. The NIST 800, 37, 30, and 39 are ones, or the ISO 27005 would be great help for you. And so that's what I would do. How's that?
And if you do this and find gaps and identify risks, and you don't start working on them with a remediation plan, you're at further risk, because then you can get big fines for not acting on known risks.
Yeah, and I'll add to that. One thing that has to happen, particularly for meaningful use, is after you've done the risk assessment and you've identified that you have gaps, you have to provide a corrective action plan. It's mandated. So that means you're going to put your neck on the line to say, here's the gap, here's how I'm going to fix it, here's when it's going to be done by. Now, one organization got a major fine, the $16 million fine, for, well, one of the things they said was, well, here's our corrective action plan, we'll take care of this, and by the next year it should be done. Well, as soon as the regulators left, they stuck it in their desk drawer and never opened it again until the regulators were back on site. And when they came on site and said, okay, show me that you've completed these items, and they're like, what items, right? And they hadn't done it, and they said, ka-ching, ka-ching, here's a fine, right? So you don't want to be in that boat either. So, and the other thing is that if you fail to do that for meaningful use, the federal government will come back and take back the funds they gave you to implement the EHR systems. And you don't want to be in that boat either. So.
Question? Yes.
What is the timeline that's acceptable to have those issues remediated? Do you establish that on your own, or do they have guidelines?
So it depends. I mean, I guess it depends on OCR, because you're required to have this covered the minute you take patient data, right? So if you don't have a control in place to protect the data, the OCR said, we're going to impose stricter guidelines and impose higher fines because it is so important, and it's up to you to protect patient data, that we're taking it very seriously, and we're going to, impose the stricter fines. So, the bottom line is you're supposed to have it the minute you take patient data. You find out, so if it's a new evolving threat that's come out, particularly like ransomware, right? This has been going on for years, and we're seeing the medical profession is getting hit big time with ransomware still, right? And they put out guidance, but that's one of the top 5 things they're going to look at in the annual risk assessment is how you're taking care of ransomware. So you have to have these controls in. I would say if you put out a reasonable corrective action plan, say, within 3 to 6 months we'll have this in place, I think that's reasonable. You're probably still going to get fined.
So, but just to follow that up, I mean, it's 12 months. I mean, sometimes I see in defense, we have these 3-year remediation plans.
Right.
Is that acceptable in this space?
Yeah, I think what's going to happen is they'll look at it from a reasonable standpoint. Like if you're now you have to redo your user access controls, right? And that means implementing multi-factor authentication across your EHR systems or whatever. Well, that's not going to happen overnight. And if you put out a timeline and a project plan, they may ask for that. That's what they'll ask for and say, show me that you're doing it. And then periodically over that time, they're going to ask for updates. So.
Yeah, if they come out during the interim and
yes.
you show good progress.
And if it's real significant, they'll park someone in your organization for the duration, and they'll be on top of it. Okay.
That has happened. So let's shift slightly to another really hot topic that we're probably all grappling with. Most of us are working with either cloud providers or business partners, and sometimes, or actually quite often, they either house our sensitive data or have access to it. Now, we spend all this time making sure our own people are protected and our data is protected, but what about these third parties? How do we know they're any good in their security controls and implementation? How do we assess them? How do we manage this third-party risk? So, Stan, you're looking at me. Go for it.
So third-party risk, everybody here has it, right? So I don't think there's anybody in this room who's not using some external application, system, service for something, right? If you think you're not, you need to go talk to your business partners because they'll tell you they are, okay? Assessing that risk and understanding what it means to your organization, right, is basically twofold. You're looking at what data are we putting into their environment, and what access are we giving them into our environment, right? And that runs the gambit in hospitals from we have an EHR that's hosted externally, maybe as a service, all the way to your HVAC system and who's coming in. Siemens maybe is coming in to work on their network for their diagnostic imaging devices, or you have your HVAC provider who's coming in and they're making environmental adjustments. So you need to understand, number one is, what is the risk to your organization in terms of the data? If you're pushing data that is not protected, right, so it's not PII, PCI, PHI data, right, has little or no value to anybody, there's probably not a lot of risk associated with it just based on the data you're pushing. But if you're pushing medical records, your email system, you're in whatever, Microsoft's Office 365, and you have SharePoint and all that stuff, and everybody in your hospital is sharing documents, and they're putting documents up there, you probably have a lot of risk associated with that, right? So when it comes to organizations, especially in hospitals, one thing I found out was there are big organizations that you're doing business with, and then there are small organizations, and you may not know the difference until you start digging into it, right? So Microsoft, obviously big, Epic's big, right? So you have some of those players, but you have people that are on the internet providing services to your organizations, like glucometer readers and things like that, that look big on the internet, and you find out it's 2 or 3 guys in Oklahoma or Ohio or something like that. They're not big, okay? One way you find out really quickly is if they're handling your PHI, you ask them for an SSA 16 or 18 report. The big organizations probably have it. The smaller organizations may not know what it is, and so you step that down and you ask them, do you have a penetration test? And a lot of them will probably say, yes, maybe we do, or maybe we don't. You ask them, do you do vulnerability management? Do you have any type of security built into your software development process? Can you explain what that is? Can you provide us with documentation?
And when they give you, when you say, can I have a pen test, and they give you a vulnerability scan, then you know it's a small company.
You know they don't know what they're talking about. And I hope everybody here knows the difference between a pen test and a vulnerability test. But it happens, right? And your business is going to want to do business with these people. There's a reason you're evaluating them in the first place. It's because somebody brought them to you, right? They want their service. In some cases, they may have already committed to their service through contract. And you're just on the tail end of this trying to make sure that it's as secure as possible, okay? Very difficult to do. Be prepared to step it down, right? Be prepared to look at contingencies, right? If somebody's out there and they're storing data, right? Look at what can we do to help that? What can we encrypt the data when it goes out there? You know, how do they have access to our data? Do they have access to the data? If it is encrypted, can we maintain the keys instead of having them maintain the keys? Start looking for compensating controls, because going back to your business unit and telling them that they can't use this service or this business or whatever it happens to be isn't going to go over very well, right? So you need to fill that gap. You need to get in there.
Have any of you had a situation where you got in at the ground floor and were able to, up front, add language to your contract, do a little bit of assessment? And if so, how did you put that program together?
Sure. Yeah, let me mention the contract. So if you can get involved in your purchasing, whatever the line of contract development is at your organization, so you work with the legal team, work with purchasing, get involved, get a signature, a sign-off that you're doing on a contract. So when you get in, obviously, if it's PHI data, they're processing, storing, whatever it happens to be, you want a BAA. So your compliance team, your internal audit, your legal team are going to try to make sure you have a BAA with them on that, so they cover everything. One thing they don't generally do is get an NDA. You, from a security point of view, want to make sure you have an NDA, because the minute you start talking to them about security controls, they're going to say, hey, we can't talk to you, we don't have an NDA. And it's going to delay the process. So as soon as the contract comes through, if you have the option of looking at it or providing input to it, and it doesn't have an NDA attached, talk to your legal team. Tell them we want an NDA on the contract. It needs to get signed. It doesn't matter if it's your NDA or their NDA, as long as you have some form of agreement where you can have that discussion with them, okay? Because honestly, if you go back at the tail end of this process and you say, now we have to start negotiating an NDA and everybody else is ready to sign off, you're not going to be the most popular person in the room, I'll tell you that.
Todd?
Yeah, I was going to say, one of the things that especially some of the smaller organizations that we challenge with, that we're challenged with, is how to manage how all these vendors are connecting to us. I think 5 years or more ago, some of these guys they were just set up with a VPN tunnel, and it was kind of like leave it and forget it. And if you need to go back and revisit all the legacy vendors and see, is there any traffic on this VPN tunnel? Maybe it's not being used that much anymore. Maybe now you could use, one of these tools where, we've set up some great new processes for new vendors where we make them, use multi-factor authentication. When they log in, they don't get access to our whole network. They only get access to the resources that they need to have access to, and it's recorded. And maybe you can go back and get rid of some of those VPN tunnels and put them on a new plan so that, you're not wondering if John Smith, who used to work at that vendor 5 years ago, left the company, and now Jane Smith came on and she just started using his credentials. You don't know. You have no idea. So putting in some controls around the user accounts, expiring them, making them re-engage and get them turned back on if you've disabled them from inactivity. Putting in some controls about how they connect, I think, is a good thing you can do too.
Yeah, I think in the beginning you want to get yourself some kind of assurance that they have some type of maturity in that security program. So you should come up with some type of assessment, and there are some readily available. I mean, there's a Cloud Security Alliance has one if it's a cloud provider. There's plenty that you can look at, but they should contain things such as, do you have a secure lifecycle development cycle going on? Is there a code review? Do you do assessments on a regular basis? Do you have a password standard? If so, please supply it. I can go on and on, but you're getting the gist of it, right? And have a list and make sure that they check it. If they say no to anything, then you discuss with them what type of possible compensating controls they might have in place. But you certainly don't want to just let them go through with a lot of no's and bless the application. You're going to have to talk to them. We got involved and helped the company put through two-factor authentication and modify what they had, because they would have the notification sent to the same email account that would notify you to allow. So if I just compromise your email account, then I got your second factor in the same email, and so someone could just go in and say, hey, I forgot my password, and they send it to you right there, as opposed to like onto your phone or something like that. So take a good look at what they've got, because even if there's a breach and it's like, well, they did it, it's your data. So guess what? It's your reputation, right?
So John just mentioned that 30% of breaches are the vendors. Yeah. What I wanted to add was I just came from the OCR meeting, and one of the biggest gaps that they're seeing is the BAA, which is the Business Associate Agreement. So on top of what they said, basically Stan and Richard, it's important that all the current vendors. I'm new to my company, so I'm doing this right now, where I'm going back to all the contracts for all our existing vendors and making sure that a BAA has actually been signed. So that's a big deal, especially for OCR. And that's all I have to say.
Cool. So we're going to shift over and talk now about what's becoming a huge issue. Well, actually, one of them is an old issue that seemed frustratingly difficult to manage, but the other is very similar, but it's kind of new, and that's IoT and medical devices. Similar type of interaction with your systems. One is life-threatening, the other is backdoors into your entire network, right? But there are companies emerging that are trying to help with this, but I'd love to hear from our panel, how are you guys managing this stuff? And this is huge. So who would like to start off? Go for it.
Yeah, so this has become very much, like Rich said, a hot topic in the last couple of years. I started hearing about it 3-4 years ago, talking about IoT, biomed devices, and they're in the same arena, but the methodologies and the things that you're going to need to do in order to try to get your arms around them are a bit different. When it comes to IoT, we realize that our medical devices are not built with security in mind. Most of the IoT medical devices have, some open source operating systems, and those of us that have are fortunate enough to have enterprise vulnerability scanners. When we scan our network, we're not even able to identify where these devices are on our network. And unless you've had a mature security program and for years you've implemented some really solid processes around onboarding these devices, segmenting them, profiling them on your wireless or your wired network and putting them in a specific place, you may not even know where all these devices are at a given point in time on your network, because most of them also move around. They'll move, and sometimes they'll go out of service and in service. And not only that, the biomed department is managing the majority of these devices. And so biomed has a whole different set of priorities for managing these devices. Their main focus is to service them and make sure they're serviced at regular intervals. And from a security perspective, we're looking at this and going, how do we manage these things that are on our network? We're responsible for everything that touches our network. So the day hasn't happened yet that I'm aware of where somebody has been killed because a biomed device, an infusion pump, has been hacked. I've heard stories about, I think, some European snowboarders that hacked into their infusion pump and increased their pain meds until they passed out. But I don't know how true that is, but I've heard some stories about that. You heard that? Yeah. So
And former Vice President Dick Cheney had his wireless from his pacemaker disconnected for fear that I don't know why anyone would want to hurt poor Dick Cheney.
Yeah.
But
so then those are implanted devices, and they maybe use some near field communication, and so Cheney had to have that disabled. So the idea is for us as security, for you responsible for security, to identify these devices, have an inventory of them, and to understand what the vulnerabilities are of the devices on our network. Is it possible that somebody could hack your model of infusion pumps? Is it possible that somebody could change a dose that a patient is receiving? Those are the things you're going to want to know. So there's a whole bunch of new and upcoming vendors that are jumping into this market in order to help us. Of course, healthcare, IoT, all organizations have IoT, regardless of which vertical you're in. Healthcare, we've got a very much, I think, the most at risk, because we're providing patient care, and these devices are providing a job to help facilitate that. So that adds a patient risk factor in that, that some life and death, possibly, potentially. I think the day will come where these devices will impact a life and death scenario, and I think when that day comes, this is going to escalate up a higher notch. But for now, it's kind of our responsibility to get visibility, to understand the highest priorities of vulnerabilities and risks, so that we could start going after it, right? We've got, I think we're very much a small to medium-sized hospital, and we probably have at any point in time over 2,000 IoT devices on our network, for providing patient care. And I think the rule of thumb is 4 to 5 per patient.
How did you know? How did you find that number?
So that's just based on inventory. Now, there are some tools out there that will help you identify all of them so that you can have an inventory real time. And the rule of thumb from some of these vendors I've talked to is the average is 4 to 5 devices per patient.
Wow.
Is what the numbers are. And so, so what you got to do is partner with Biomed. So if your tool can help Biomed find where their device is at and know which AP they're connected to and which ones are online at any point in time, you're going to get them engaged. And they're going to help. They're going to help because they want that.
Yeah.
I know a lot of Biomed devices are pushing for $1 million RFID system because they spend too much time looking for equipment. So if you can find a solution that does a win-win and helps you not only know what's on your network but where it's at, they're going to be engaged with you, and that's going to be an important way to get them engaged.
Yeah. I can add to that.
Sure.
Yeah.
So speaking of, you guys hear me okay?
Yep, you're on.
Speaking of IoT and the biomed devices. I came from IoT, by the way, and so I know a little bit about infusion pumps. So my company, I'm a very big player in the infusion pump industry. Basically, we're scrutinized by the FDA constantly, and in the last DEF CON that we just had, we were actually, I won't say recommended, kind of the FDA just asked us, not told us, to take our infusion pumps over to DEF CON and see if they can get hacked. Well, the old stuff got hacked, unfortunately, but the new stuff couldn't get hacked. But doesn't mean it won't get hacked, anytime soon. The thing is that the company that I came from, they're very responsible when it comes to the infusion pumps and the data that they store and transmit also. And the problem is the fact that we don't allow the medical companies, and whether it be clinics, hospitals, or whatever, we don't allow them to go in and make any changes to their infrastructure that actually supports those medical devices. So that's a big problem. And because of that, it's hard for us as security professionals to patch those servers that support those IoT devices. That's a big problem for us. So I know this company is actually working on moving away from that, where now that information is going to be stored in the cloud by the medical device company. So that's another risk that this company is taking on. But at the same time, it kind of takes the responsibility off of us when it comes to the server environment. Although we don't lose, we still have that accountability to make sure that data in the cloud is still being protected accordingly.
John, you wanted to add?
Yeah, so where I was, we had 20,000 IoT devices. How do you manage that? Because we didn't have the capability to do that, and you can't do scans against those devices because it can affect the outcome and kill patients. So what you have to do is you have to have some kind of mechanism on your network that will interrogate packets coming through. So you got a lot of companies that are doing that now. I think one of the foremost ones is Metagate that I've dealt with. And what they do is as I said, they interrogate the packets coming across, and there's so much information that comes through those packets, so they can tell what version the device is, what patch level they have, and so on and so forth. So they can go out and look at, whether there's a vulnerability against that device and how to deal with it. The challenge is there's so many device types out there of IoT that there are companies that say, oh, we can interrogate your devices. The problem is they can interrogate 95 types, but there's 3,000 something types out there, right? So you're not going to get the confidence that you have everything monitored, but you have to do something, right? And the challenge is if you don't do something like what happened to this hospital system in 2017. One of those IoT devices was hacked, malware was injected, and it spread across 9 hospitals. And it knocked out services for about 3 months, okay? Now, that impacted a lot of patients. It impacted, obviously, revenue for the hospital system. And it took a while, like I said, to remediate. They had to move all those devices onto protected VLAN so that if something happened, in the future, it would be localized. Also, it was known that out of that ransomware, 445, you got to block that, and so on and so forth. It's ugly, but until they build security in, these are the things that you're subject to. Plus the fact that you have vendors coming through your firewalls to touch those machines, and you have a big exposure there. So that's going to be addressed, in new legislation that's come out for California that will, from the FDA, that any new devices will have to have security built in. But you, as a security practitioner or a risk manager in the hospital systems, have to come up with a plan and identify what the issue is and how you can mitigate that.
How many of you work in organizations where you have an application development team building some apps? Okay, it looked like over half. So what I'm about to have the guys discuss is pertinent to you, and for those not, it's something that you should think about for your business partners who might have their own development, and that's probably the other half. The SDLC, you need an S in front of it, secure. How do you make that happen? How do you integrate that into the application development lifecycle where you work, right? So, Doug, I know we've talked about this for years. Share your experiences.
Okay, so for those of you who actually have proprietary applications built in-house, it's extremely important, just as much as like when if you have Epic or NextGen, to actually make sure that these applications are secure. And what I mean by secure is that they can't get hacked in any way, shape, or form, whether it's internally or externally. What we've done, and what I've done in the past, basically, is pretty much embedding the security organization, into the application development process. So there's different ways of doing it. It depends on whether if you're following Agile or if you're following Waterfall. The Waterfall is legacy. It's much easier to embed security into that program because all you have to do is just put specific gates during the SDLC life cycle. And during these gates, for instance, if you're developing, and while you're developing, you want to do static scanning of your code as you're developing. Once you're completed developing and you're ready to go into testing, you would do what's called dynamic scanning of your code. And that's usually done by some kind of a vendor that you could acquire, to help you do this. There's all kinds of vendors out there that do that, both static, dynamic scanning. You can do it yourself. It's probably not the easiest thing to do. But we do also do, you want to do secure code review. That's also important. So that's during the gate of development. Now, when you start moving into user acceptance testing and regression testing and so forth, once that's been completed, then you actually have to do a pen test, an actual pen test of that application. And then once that's done, of course, you have to, you get a report, right? You have vulnerabilities, and they have to be remediated. And the same thing follows for static and dynamic scanning. So it's a very simple process. But the thing is, as simple as that process is, for some reason, it's so hard for organizations to do it. And they complain about, we slow them down. They can't do this in the appropriate timeline. If they're not properly securing their code, so it's going to take a long time to get it remediated because they don't have the proper training. So to actually help organizations to do this, that's why these vendors came out, where now you can actually, although I'm embedded into the project for secure coding, the application development team actually owns that portion of the static and dynamic scanning. They do it on their timeline. And the only thing they have to give to me is just a report. So as well or as good as they are as developers will determine how fast they can get their project done. So that's very key. And what I ended up doing also, I started seeing where audit was coming in and doing post-implementation reviews or pre-implementation reviews. That was slowing us down also. So by embedding them into the project, that actually helped a lot also. So because we're partners with audit, we make sure that we're helping one another. So that's one of the things that I basically done. I was going to go in more detail, but I don't have a lot of time left. I'm like a few more minutes. Yeah, about 5 more minutes. So I'll end right there.
So for those of you who are not well versed in this, static scanning scans uncompiled code, and it's usually the developers where if you want to purchase a system, it's embedded in their system, and they'll check in their code, and it'll let them know what doesn't look right, and it'll actually give recommendations of what they can do, where the line of code is that's questionable. Because we know that fixing something right then and there versus fixing it later on, the cost differential is monumental, right? Because the developer will have to go back, try to find where it is. At that point, they won't know what the impact is, how it relates with other areas in the code, and it can get monstrous. And so the cost could be 10 times as much, and that's where it really could slow down. Now, the dynamic scanning scans the compiled code. That's typically, not always, done by you guys, the information security team. And they then go back to the developers okay, so let me just step back a second. It'll issue a big report. Here are all these vulnerabilities. Boom. You can't take that and give it to the developers, or you'll lose them as partners forever. You got to go through it yourself first. Weed out the false positives, and also false positives not just in that the system made an error, but because all of us have different environments, and some things are protected in other ways, and it might show that, well, we don't worry about that where we are because we do other things, or we don't use this even though it's showing up. So you take this report and you whittle it down to this, then you sit down with your development team and you discuss it, right? Because they'll point out things that you didn't know about, right? So you don't just give them the report because you're partners. One of the issues is, you know, we're security guys. They're developers. It's not that common to find people that know both. How many here are good coders? We've got a couple. See, that's why they're here. But not a lot, right? And so that's a tough thing to do. And so if you're looking for people to hire, I would suggest you give at least one or a couple of people on your team that know some code so they can talk the application developer language. And then you have that interaction, and then you build that camaraderie, and then they'll trust you.
So just briefly, if you take your development staff and send them to some security training, there are courses for secure software writing. Spend the time, spend the effort, do it. You're going to get it back because they won't be writing bad code. They'll still write some bad code, but it'll be a lot less. There's a lot less to remediate in the long run, right? So help yourself out and get a little training for your teams.
And my experience, developers, there's quite a lot of them that want to learn more about security, but the school programs don't build security into the program. They teach you how to be a great coder, not necessarily know about secure coding.
Yeah, and like I said, there's vendors out there where we hired a really good vendor that basically had training on the job. So it's on-the-job training program where a developer, when he's developing and he's sending it into the cloud to have it statically scanned, it actually tells him what he did wrong, how to fix it, and it doesn't matter whether it's .NET or Java or whatever language you're programming in. This vendor, there's more vendors now, but just great. It's just a great program where they embed the application developer into the security, established framework for application development.
And also look at your application development team. You'll always find at least one person who really cares about security, and you can make them a security champion. They can be the spokesperson that you interact with, and they can, spread the gospel to their team and get more people on board. Because the other developers would rather listen to them than you. I mean, that's just, that's it.
I'll add to that. So we had a huge development team in India, right? So the good news is it's cheap labor, to write code and everything. The bad news is there's so much bad code coming back, that you have to, build in these secure procedures or security procedures to monitor the code. One of the big problems was in API calls and backdoor exits, which they always would build in, right? And you have to make sure that those get eliminated. That's a huge thing. And I've had a company recently that said, look, we write all our code, but what kind of a security program do we need to build to check for API security? It's a huge issue.
We had a funny situation once where we wanted to scan, and then the developer said to us, we'll exclude those libraries because we didn't write those. I go, well, wait a minute. Insecure third-party libraries are the norm because they'll just grab anything off the internet, and 3/4 of the libraries that they use are insecure. This is a known fact. So make sure you're scanning these libraries, and they say, well, that's not ours. Say, yes, it is. By using it, it's now ours. Exactly. Yes, sir.
I just want to add on to that, Richard. It's also important that you go back and scan later, because some of those libraries will be like, oh, it's secure now, but then later somebody finds the vulnerability, but you don't know you have it in there unless you periodically later run that code through again just for the heck of it to see if something new popped up.
Yep.
Like, oh, wait, we have a bad component.
Yeah, the nature of scans, it's a snapshot. The next day, you could be at risk, right? Even if it shows you, and that's with everything. Our network scans, absolutely.
Yeah, and one of the things that actually kind of saved us was having a web application firewall, because it always looks at OWASP top 10. And so that's kind of helped us a little bit. So that was another additional control that we actually put in.
He just warmed my heart. He said the magic words, OWASP. You know, I'm on the global board, right? So I'm going to make sure you all know and use OWASP tools and frameworks and training things. Yes, sir. Oh, peace to you, too. So he's just giving me the 2-minute warning. So, questions from anybody? Yes? So you're talking about combining inventory assessment, third-party risk, and what was the third? And bioengineering.
Yeah, we did the same. So do you have like a privacy and security steering committee? Okay, so that's probably the first place to start, is build the partnerships in there and have the principal groups that you're working with report out where they are on their roadmaps, what's coming down the line. That will help get everybody more on the same page where you're talking about it, okay? Once you do that and everybody's pretty much on the same page, you're all going together pretty well, people will start picking up the phone and calling you and telling you that we're doing this or we're thinking about doing this, and you have more of a give and take partnership, right? It's tough when the departments are isolated and everybody's working to their own goals, all right? You have to find a way to break down those silos.
Yeah, you can normally get when you go through a vendor for CMDB, because there's quite a few of them actually. They can actually help you. They'll help you put it together, create that database that you're looking for. Because you want to be able to tie them together somehow, right? So the thing is that you just have to work not only with the business itself and IT, but you have to work with the vendor also.
Just real quickly, so one of the things you got to do, I don't know any healthcare organization that can know 100% everything on their network at any given point in time. I don't anyone here to have that yet? It doesn't exist.
Unless you have network access control.
Yeah.
When you really get network access control, you're good.
Fully implemented.
Fully
Yes.
Yeah.
Yes.
Yeah. Fully implemented, 100% implemented.
legacy equipment won't work with it.
Yeah.
Then you put it somewhere else.
Does that help out in the IoT?
Yeah, so you're going to have your CMDB, you're going to have scans, you're going to have data that's going to come in, and you're going to have to kind of manually try to marry some of that stuff together. Get in front of anyone that wants to bring anything to the network. Make sure that they come to you first. There's something from Biomed that all Biomed device manufacturers have that's called the MDS2 form. Make that a requirement before anyone purchases anything. Get it in front of your contracts in your acquisition department and look at that manufacturer disclosure statement so you understand what's coming on your network. But it's going to come from different sources.
And that's good if you're centralized. But if you're decentralized, your problems are magnified, right? So, like in our case, we had 46 different hospitals, right? And everybody has IoT devices, and they have local IT directors, but we have a central, network management, right? And so you're right, if you have something like Darktrace or something that's constantly monitoring your networks, then you can pick up things and you can compare that with what you have in inventory. So we would write, scripts or have programs that would check against current inventory. If it's not found there, we immediately, issue an alert. We had to go find out what this is. We didn't quite have, a mechanism to block them because we didn't want to block traffic per se. But everything had to be registered to Active Directory or our own system. But that's one way to do it. But we knew, for instance, all the IoT devices. Because we could get the traffic, but we didn't know that what kind of security we had on them.
We're about out of time. I just want to echo one last point raised by our keynote this morning. We talked about static and dynamic scanning and pen testing, all the things we do, to ensure that our apps are being securely deployed. But fuzzing is now becoming much more of a tool that's in favor rather than the kind of clunky, scanning tools. So look up fuzzing, talk to some people about that, and see if that's right for you. But right now, I'd like you all to give thanks to this great panel. And these folks will be around most of the day, right? Anyone have to leave early? Oh, good. Okay, so go talk to them and continue this conversation. Thanks. And make sure you consider going to the CTF that's in the Marion Davies house across the way. There's prizes awarded if you want to test your knowledge. Thank you.